are done to assess the functions of different parts of the nephron. Renal clearance of a substance is the volume of plasma that is completely cleared of a substance by the kidneys per unit time, and it is calculated from the following formula. C is equal to U into V divided by P, where C is clearance and U is the concentration of the substance in the urine and V is the volume of urine excreted per unit time, and P is a concentration of the substance in the blood. Okay, so clearance is equal to amount of the substance which is present in the urine divided by substance present in the plasma. Measurement of glomerular filtration rate. A substance that is completely filtered but neither reabsorbed nor secreted should be used to measure GFR. Inulin is the substance that is used to measure the GFR. Inulin clearance test. A large initial dose of inulin is injected intravenously into the body. To maintain a relatively constant arterial plasma level of insulin, the insulin is infused at a constant rate into body. After some time, concentration of inulin in the plasma in the venous blood, that is P inulin, and urinary concentration, that is U inulin, and the volume of urine excreted per minute are determined. So thus inulin clearance can be given as clearance of inulin is equal to urine inulin into volume of urine divided by plasma concentration of inulin. For example, the concentration of inulin in urine is around 125 mg/cent. The plasma concentration is 1 mg/cent. The volume of urine output is 1 ml per minute. So the clearance of inulin gives the GFR. Inulin clearance is used as an indicator of plasma clearance mechanism. A comparison of clearance of a given substance with the clearance of inulin provides information about the renal mechanisms used to remove the substances from the plasma. When concentration of any substance equals to clearance of inulin, that is clearance of any other substance equals to clearance of inulin, the excretion is by filtration is occurring alone. And when the clearance of other substance is less than that of clearance of inulin, the excretion occurs by filtration and there is some amount of reabsorption as well. When the clearance of any substance is more than clearance of inulin, the excretion is occurs by filtration, and it means that there is the substance is also secreted. Creatinine clearance. The most common method to measure GFR in clinical practice is to determine 24 hours endogenous clearance, creatinine clearance. Its determination does not require any administration of exogenous creatinine, as creatinine is a product of muscle metabolism. The normal range for creatinine clearance is around 80 to 110 ml per minute. However, some creatinine is reabsorbed by the tubules and some may be secreted. So when precise measurement of GFR is required, inulin clearance is preferred. Measurement of renal plasma flow. To measure renal plasma flow, a substance which is filtered and secreted but not reabsorbed should be used. Such substance is para-aminohippuric acid. Para-aminohippuric acid clearance. A known amount of PAH is injected into body. After some time, concentration of PAH in plasma and urine and the volume of urine excreted are estimated. Since PAH is completely cleared from the plasma, the clearance rate of that substance is equal to the total renal plasma flow. So pH clearance is equal to urine pH into the volume of urine divided by the plasma concentration of pH. So this is going to give about the determination of the renal plasma flow. Even diode clearance can also be used to measure renal plasma flow. Measurement of renal blood flow. To determine renal blood flow, value of two factors are necessary, that is renal plasma flow and percentage of plasma volume in the blood. So thus renal blood flow is almost equal to renal plasma flow uh, divided by percentage of plasma in the blood. So the formula can be expressed as renal blood flow is equal to renal plasma flow into 1 minus 1 divided by 1 minus hematocrit, where HCT is hematocrit. Renal plasma flow is measured by using pH clearance. The percentage of plasma volume is calculated indirectly by using PCV. If the PCV is 45%, then plasma volume is 100 minus 45, that is around 55%. Quantifying renal urine concentration and dilution. That is, it is mainly done by osmolar clearance. That is nothing but the total clearance of solutes from the blood and can be expressed as a osmolar, which is expressed as a osmolar clearance. So this is the volume of plasma cleared of solutes each time. So clearance of osmolarity is equal to urine osmolarity into the volume of urine divided by plasma osmolarity, where OSM is the urine osmolarity, V is the urine flow rate, and POSM is the plasma osmolarity, as we express. Free water clearance, it determines how much water is reabsorbed or lost while concentrating or diluting urine. It is calculated as the difference between urine flow rate and osmolar clearance. So water clearance is equal to urine flow the, minus the clearance of osmolarity. That is equal to the volume of urine divided by urine osmolarity into the volume of urine divided by plasma osmolarity. Thus, the rate of free water clearance represents the rate at which solute free water is excreted by kidney. When free water clearance is negative, water is conserved, and when it is positive, excess water is excreted